Hi, my name is Lauren Wood and I'm 27 years old. The accident actually happened during a gig, so I immediately lost feeling. So next day went to an urgent care center, excruciating pain, and they immediately were like, you need to go and see this surgeon. This is a serious spine issue. And so Dr. Varma was the first recommendation. One of the things I noticed immediately upon the time I woke up from surgery was that all of the feeling had come back in my right arm. The pain had severely diminished. I didn't have the same numbness in my hands anymore. That change was immediate upon waking up. And I'd say the healing process, I was able to really be up and moving and doing things within about 2 days or so, and I was back to my normal standard of living within about a month, albeit some like weight limitations. I couldn't lift a ton, but even under less than a year, I was already back. I took painkillers for about a little less than the first week, but after that I didn't need them. Probably, honestly, within like 3 or 4 days, I was able to start the switch to just Tylenol occasionally. But I'd say that I was able to be back playing saxophone in general about like 2 months. I was able to go back to playing. I had to have some modifications. I play a really large saxophone, so I had to have a special stand made. There were some lifestyle changes, but as far as actually being able to work as a professional musician, I was completely good to go in less than half a year. Absolutely, without a doubt. I know that the main thing is that I was 24 years old when I first had my discs herniated, and I had had them herniated for probably around the age of 19, even though I didn't know it. And a lot of people at my age discourage surgery. They see it as an extreme option. You know, I know that getting the Mobi C disc is technically considered a newer procedure, so sometimes people are more apprehensive, and Dr. Varma is one of the best people doing this surgery. It was great to have someone oversee my care from start to finish, not just the intake, but the actual surgery itself. So I know that that made a big difference in me choosing to follow through with it. It's obviously I got more than one opinion as to whether or not I needed this surgery. And I don't think what I'm doing now would be possible if it hadn't been for his great care. And I wouldn't question, I think anybody else should be going to see him for this kind of procedure. I think he's very supportive, and to put it really bluntly, he really got the job done that needed to be done, and he did it well.